Well, smoke from the deadliest wildfires in California history is creating a statewide health hazard. Thick, toxic smog is hovering over city skylines near and far. The polluted area has created a health risk for Californians. Many have resorted to wearing masks outside. There is some relief in sight. The air quality is expected to improve slightly by Wednesday. Dr. Michael Jerrett is a professor and the chair of environmental health sciences at UCLA's Fielding School of Public Health. He joins me now from LA. So, Dr. Jerrett, explain to us what about these fires is causing so much air pollution?
Yeah, so there's a huge amount of biomass material that's burning, so wood and other plants it's creating a tremendous amount of emissions. The emissions are what we would call primary emissions, so particles that come directly out of the wood, and then also secondary emissions. So some things are emitted as gases and they undergo photochemical changes when they get into the atmosphere, so they form secondary organic particles, or even ozone can be formed from the fires. So you get this very complex mixture of gases like carbon monoxide, nitrogen oxides, volatile organic compounds, and then the particles themselves. And the particles are really the principal concern because they can deliver a lot of toxins directly into the breathing zone of the lung. So we call them respirable particles when they're less than 2.5 microns in aerodynamic diameter. And they can penetrate right into the area where we have the air exchange in the alveoli and cause a lot of interference with our normal lung function and subsequent illness and potentially death.
We see people wearing masks. I've heard statistics that say it's like smoking half a pack of cigarettes a day, just the daily air quality in some of these parts of California. When you talk about long-term effects, what are we looking at over these wildfires?
Yeah, so we know a lot about what happens in, say, the immediate 2 or 3 days or the day of the fire. We're much more likely to see emergency room visits and hospital admissions go up, and we are also likely to see increases in the mortality in the population. So we have these immediate, or what we call acute effects that occur on a matter of days, perhaps into weeks. And then if it's sustained over a long period of time, months to years, you can begin to affect numerous major bodily systems that can lead to disease and premature death. What we don't have a good understanding of, with what some people are calling is the new normal now, with the frequency and severity of these wildfires, is what it means to be hit with this, say, 3 or 4 times a year, where it's an event that goes on for a month or more, and the levels are really quite high for that period. So we don't have a lot of really good scientific knowledge about what this repeated exposure to these strong pollution signals will do. But we do know from numerous studies that have been conducted that chronic exposure to particulate matter and to ozone can cause birth problems. So the babies come out and they're low birth weight for their gestational age. It can cause asthma as they develop into adolescence and into adulthood. There have been studies that have shown that chronic exposure to particulate matter is related to smaller lung function, so that by age 18, children who are living in very polluted areas might have 20% less lung capacity than those in cleaner areas. And that can have lifelong effects in terms of chronic obstructive pulmonary disease and the development of heart disease. Eventually, the air pollution is thought to cause increased risk for diabetes, for heart disease, and for high blood pressure and hypertension, all of which can manifest in increased risks for heart attacks and strokes, and ultimately premature mortality. So we do have a lot of evidence that air pollution affects us really from the point of conception to our death, and many points in between.
The health risks certainly are not good with these wildfires. Dr. Michael Jerrett, I want to thank you very much for joining us.
It's my pleasure.